Good evening, Tewksbury. This is Thursday, July 16th, 2020, and the time is 6:01 p.m. I'd like to call this meeting of the Tewksbury Board of Health to order. First, before we go into the agenda, I'd just like to do a verbal roll call. And what we have done tonight is we've tagged the dial-in callers, but I don't see them anymore. So I don't know what happened with the dial-in callers.
I can see Charlie.
You just have to scroll at the bottom. There's an arrow.
Oh, okay. Okay. So we'll just go around, just do a verbal roll call. So I, Chair Ray Barry, is present.
Vice Chair Robert Scarano, present.
Maria Zaroulas, clerk, present.
Charlie?
Charlie, I'm here.
Okay. Tony?
We lost Tony.
He's between a couple of motions up there. He'll be back.
And then we have a call-in line, so I'm not sure who that is.
Mr. Chairman, the call-in line is the second computer we're running for participants.
Oh,
And-
okay.
And Tony did say that he was in a spotty area and that he might be dropping in and out.
Okay, perfect. Okay, and then from the Board of Health side, Health Department side, we have,
Director.
okay,
Irvi Agarwala, Public Health Nurse.
okay. Good. So the first item on the agenda tonight is approval of minutes of the June 18th, 2020 meeting. Both the clerk and I have reviewed the minutes, so what you have received by email earlier this week were the edited minutes. So anyone have any edits or comments they'd like to make on the minutes of the June 18th meeting?
I have nothing here, Mr. Chairman.
Okay, thank you, Mr. Rue.
I have nothing here, Mr. Chairman.
Okay, thank you, Mrs. Scarano. So someone like to make a motion to approve the minutes as submitted?
I will make a motion to approve the minutes from June 18th as submitted.
Okay, so, and who'd like to second that motion?
I'll second them, Mr. Chairman.
Okay. So motion's been put forth and seconded to approve the minutes of the June 18th, 2020 meeting as submitted. All those will signify by stating aye. We'll take a roll call vote. Mr. Scarano?
Aye.
Mr. Rulis?
Aye.
Mr. Rue?
Aye.
And let me just see if Dr. Bichetti is back in. Does not look like it. Okay, chair votes aye as well, so the motion carries unanimously 4-0. Okay, we had nothing for old business, and then under new business, we had 2 items. First is Chelsea Slater, who is an applicant for a body art practitioner license for tattooing at Route 38 Tattoo Salon. Director Sawyer, anything you'd like to lead off with this?
Sure. So the Health Department received Chelsea Slater's application on July 8th, and it was reviewed for all the requirement for education, training, and Irvi Agarwala looked at the medical history and requirements. She has submitted everything that's required. So I'm presenting her to the board to receive her license to practice tattooing in the town of Tewksbury.
Okay. And Chelsea, this is just a formality, so it's only so that potential practitioners in town are able to meet the board and just see who we are, and occasionally members may have questions. So anything you'd like to mention to the board first before we see if anyone has any questions for you?
I just wanted to say thank you for taking the time to review everything for me. It's a big switch. I'm moving from one shop to another, so I'm in transition with everything, and I really appreciate you guys being so willing to get me in as and Todd Arsenal was also present. He's currently
I neglected to say that Chelsea's been working in the city of Taunton, licensed for 4 years now, and I've only heard good things when I reached out to Taunton about you, Chelsea. So all good.
If it's okay, if I could just add a little bit, Susan.
Yes, go right ahead.
She is a multi-award winning artist. She is very, very well known in the artist industry. And like we spoke before, we're looking for the best of the best. And I'm really thinking we're fortunate enough to get someone like Chelsea. If you ever do stop in at some point, you can see massive amounts of trophies she has in her area that we hope she'll be working in. And I just feel like I needed to add that in because she's very accredited, and I thought it was a great addition.
Thank you, Todd.
Thank you, Todd. Any questions for Chelsea regarding her history or education, anything?
I had missed some of it. I apologize. My phone had disconnected in a bad cell area in my travels, and this was being presented for tattoo artists only. Is that what we were at?
Yeah.
Correct.
Yep.
Yes, that is correct. A full license, not an apprentice. A full license, though, for tattooing.
But just tattoo artists only.
Yes. Yeah. I submitted both. I was licensed to Pierce as well, so I had both. So I didn't know what the town restrictions were or anything like that. So I just submitted it with everything, and I didn't know what every town's different. So I just submitted it with all my licensing to see if it was something that's welcomed or on the fence or not at all. I wasn't really sure. So.
Okay. So yeah, every town is different. So, but I just wanted a confirmation on that. But yeah, but tattoo only. Okay. Thank you, Chelsea. It's very well accomplished. That's wonderful. Congratulations.
Thank you very much.
So Chelsea, that was our main question asker. So I think you passed muster.
Yeah.
Well, the original question we have, Chelsea, is: are you familiar with the emergency plan and that Todd has in place for bloodborne pathogens spill or accidental spills, things like that?
Yeah.
Great. Great. I'm sure you can offer some ideas too.
Yeah, it's nice. He's very welcoming over here. I think for like a really nice work environment. So I'm excited to get started.
Okay, I have nothing further to add to that.
Okay. Any other board member have any other questions for Chelsea?
No,
I have
I
none.
believe if I don't believe I have any. Susan asked the question I asked. As long as every facility has a unique infection control plan pertinent to their specific environment and everything. So that's one of the questions. Do you, as far as even the tattooing, Chelsea, one thing I know had our meeting. I apologize. I'm on the road. I'm actually working, and the connection's not always that great. I know that we've always discussed with, as you're well aware, Todd was the first license that we had graduated for Route 38, had conferred, and that's good. And we've had great success with, we just want the best of the best in our community. One of the things I know that Todd had always said about before, and we've always asked the other artists in the past, Are you just planning to tattoo from the neck and below, or I mean, you have extensive experience? What is that was always the understandings that we had with
Right.
Todd
Yeah.
here. And go ahead. I apologize. You can go ahead with it, Mike. In case it faded through. The reason why I asked that is when we start doing things in areas that are prone to more potential infection liabilities, and as I said, I know that from the beginning, Todd always said that he was going to make sure that they stay from the neck down. Is that a philosophy that you agree with at this point in time? Okay.
Yeah. I don't even at my prior shop, face tattoos weren't something that I was comfortable doing. Not from like a skill set point, but from
totally.
So yeah.
I totally understand. Yeah.
Yeah. It's the same. Not that we're going there with it, but just to relate back to it to help answer the question. When I pierced, there were only certain areas that I pierced because of I wasn't comfortable with high risk piercings, just because of the level of maintenance that is reliant on the client. So
yeah, I know. I
of,
deal with it every day. Yeah. Yeah, and it just exposes and that's fine. And as you're well aware, piercing something is a whole different situation. Yeah, exactly. So that's fine. But yeah, it's like I said, we welcome talented artists in the community. Like I said, our whole goal is to protect the public as best we can and have the best of the best. And unfortunately, you being in the business for a long time are well aware that a lot of people do want to come in to communities, and it's a learning process. We've been very fortunate that Todd's been able to, start an apprentice program, because one of the things that I've always, people have to learn somewhere, and I find that it's best if they do have a program. And I think one of the things that, and I've always said this, I think it's been a disservice to your industry that people in the field didn't set up more standardized guidelines. Yeah. So, I mean, from the state, and as I said, where the guidelines are set such as they be by local communities, we've been very fortunate. We have a very receptive board, a very compassionate board, so we try to make sure that we're all on the same wavelength. We just want what's best for our community. So it's good to have accomplished people like yourself come in and as well as be aware. And people have to learn. And my experience on what our board has seen over the years is there have been people that, in my opinion, did not have the qualifications or the standardization that they should have, because there was no set program. So that's and that's why we were concerned about potential issues and liability issues that come about. One thing for someone, I think you, outside of Todd and one of the other people that we've given a license to, you have a great volume of experience, and I know this is one of the things we're talking about. Do you feel, from the standpoint of the business that you're in and the clients that you've seen over the years, and I know in speaking with other, we always like to hear the good stuff, but I also hear of in the field I'm in, as well as it relates to other germane issues. Do you feel that people in your field nowadays should carry some type of liability insurance? It's not required currently for people, but we're looking at it as a board, and when we have the opportunity to speak with you at this time, I'm just wondering what your feelings are on that.
I agree. So I when I practiced out of Taunton, I had a liability insurance that was covered for the whole shop that I worked at. Todd has the same thing. I think it's a great idea. I think anybody that practices, like, I mean, for sake, a medical procedure should have some sort of liability insurance. The process that.
Well, just to protect himself. I wasn't aware that Todd had I know he had liability for himself, but I wasn't sure in the business. But I wasn't sure it was for the individual practitioners. Is that something that's changed?
I actually added on after the COVID. Actually, probably the week before we opened, I added quite a hefty amount of insurance to all the COVID and everything going on right now.
No, that's good business, I think, Todd, and I'm glad to hear that you've done that additionally. So that covers not only the COVID procedures, because unfortunately I deal with insurances daily, and insurances get they're more concerned about the exceptions rather than the generalities, and
right.
So what happens is that even covers your artists now from a standpoint of their liability when they're providing tattoos that goes above and beyond just the COVID issues that come up. So that's great then, and it covers everybody.
I went above and beyond it. It covers terrorism. It covers a $5 million umbrella. Exactly like we spoke about before. I love my home, and my kids love my home, and I never want to chance of losing that with improper insurance. So I did some research. I think we've covered all the bases on this one.
Oh, that's good then. Well, and it's great to hear that Chelsea's endorses that type of, she's a seasoned artist. So I think it's good for the younger people, or I don't want to say younger in age-wise, but the less experienced people to start to consider that for their own. It's just, it makes good, business sense, and so it's good. So that information you gave us helps us when we develop our, we're in the process of trying to finalize our plans, Chelsea. So thank you very much. I mean, that's the last question I have for someone, and hopefully I'll get to meet you in person someday and see some of your work. Thank you.
Yeah, please. I'd love to show you.
Okay, so welcome to the town, Chelsea, and I think we're all set with you. So good luck in your future.
Thank you, guys.
Yes, best of luck, Chelsea.
Lisa will be forwarding your permit to you. I'll let her know. She'll be forwarding it tomorrow to Chelsea.
Thank you, Susan.
Thank you, everyone.
Yep, take care.
Good luck, everyone. Stay safe.
So on it's a good segue into the other item under new business, which is a brief discussion on the Board of Health Body Art regulations. It's been something that's been off and on again in terms of the rewrite from my end. So my goal is to try to have this finalized in next month or two, and with it there'll be some type of a quiz we'll have to sort of be able to test the applicant's knowledge of anatomy and physiology and infection control. So Susan, you've shared some documents with myself and Dr. Bichetti, so he'll be looking at the quiz and I'll be looking at getting the regulation rewrite completed. And two of the things on that one we just talked about in terms of malpractice insurance, and we've had several working group meetings about this and talking about the type of facility we're looking for, as well as malpractice insurance. So those will all be included in the rewritten regulation. And then the other piece, I think, to your point, Dr. Bichetti, we do not have in the current regulation a specification or a limitation on what parts of the body can or cannot be tattooed. So that's something else that I guess we can always look at putting into, is just sort of the from the neck and below for,
Well,
for tattooing.
Right, and thank you, and thank you. You know, I think had it not been for the COVID-19, and I apologize for the noise. I think had it not been for the COVID-19 interruption, we would have. I would like to make a motion as well. I honestly believe that the delays we've had with the COVID-19, I think that somewhere between what are we now in July, August, I would say that we work on this, and I would say roughly we had a 4-month delay on this. I would say that realistically, so that the community can have an idea where we should have everything finalized, I would request we make a motion to have the ability to take the time necessary to thoroughly review all the information that we started to work on, and have like a moratorium or till we finalize things. So I would say we should, by the first of the year, we should have all the regs in place so that it'll be self-explanatory and very quick, and the test in place for everyone to take if that's something that other people. I would request a little bit more time just because of the delays with the COVID-19 virus to have things in place.
So that was the other item of discussion, was just that we need to review as part of the rewrite, review the other modalities of body art besides tattooing.
Mm-hmm.
So two of them come to mind are body piercing and the whole microblading, micropigmentation. And one of the things that individual board members have expressed desire for is, rather than trying to have an all-inclusive list of what can or cannot be pierced, such as Director Sawyer had shared with us what the Taunton regulation is that we feel that there's too much of a health risk in the body piercing, so that's something that we'll be looking adding into our regulation, is prohibiting the body piercing. So what we were looking at doing was to give us time to get the regulation rewritten. I'm actually totally looking at a 90-day moratorium. So I emailed Maria motion for that, because I want to make sure that we have this all done before we get into the fall, because I'm concerned that come fall time, COVID may come back around to bite us, and we want to make sure that everything needs to be done with the health department in terms of the updated regulation, that we try to get this done before the fall really sets in, and they're tied up with other matters. So
okay, yeah, a 90-day, yeah.
I think 90 days. My goal originally had been if we could get the final rewrite on the agenda for the August meeting. September meeting.
Yeah, August is.
That's still
close,
within
yeah.
the 90-day window, but I'd like to make sure that we get this done sooner than later.
Yeah, that gives us at least that gives us, I'd like to have a little flexibility, but that sounds reasonable where we are, because I think that we just need to sit and review everything and put everything in place. But that's fine. I don't have an issue with that. If we can do that, that would be fine.
Yeah. So the motion, or actually, Bria, did you get the email?
Yes, I have it.
Okay. So I was just looking at having a 90-day moratorium on the issuance of establishment, practitioner, and apprentice licenses for all modalities of body art, with the exception of tattooing, which is just allows chance to get the regulation rewrite completed. So Marie, maybe if you...
Yep, I'll make the motion.
Can I say something? Go ahead, make your motion. I was going to make one comment. We're talking about not accepting applications for establishments to add other modalities, as well as not accepting applications for for the actual practicing? Or are we supposed to accept the applications and tell them there's a 90-day?
No, I think I would rather not accept applications because I don't want to have fees be paid and then have to refund fees. So I think it's cleaner to not accept any applications.
Can we have a discussion on that for a moment?
Oh, yeah.
While we're discussing the moratorium, I would only suggest that we consider the fact that during this health crisis, a business may lose a person to the art or as a practitioner, and we would be handcuffing that business from actually moving forward with a replacement unless they had someone in the roster. I'm just wondering, should we reconsider having applications taken in the event of an emergency that they would like to continue and the executive order doesn't prevent it? Maybe the board would be able to consider an emergency replacement on an emergency basis.
Can I add to that, Bob?
Sure thing.
I'm glad you brought some kind of mechanism up. I honestly have to say that the way we have these, if someone does come down with the COVID-19 and by the time you got tracing, I mean, it effectively could shut down a whole facility anyway, for 2 weeks anyway. So what I would prefer to do, if there's a way we can make it happen, I would much prefer to keep it clean, like Ray said, be cognizant of the fact that this potential issue could happen, and maybe we could add in the motion, since you are the master of motions, maybe we could add something that we can have some kind of emergency meeting or to accept something under these circumstances, because I do get it. But I honestly think if someone does get COVID, they're going to be shut down for 2 weeks, because if they've had it, they probably had contact with people in the facility. And I think it's a good point you brought up, but in the order of keeping things clean and letting us work on it, is there a way we can add something into the motion so that we could address this should this circumstance come up? It's such a...
Well, I was actually thinking of non-COVID reasons for an emergency. We certainly understand the effect of COVID upon a business and the tracing that's associated with all the employees. I was actually thinking of
you would use the word
COVID.
COVID. Yeah, oh, good. Well, you would use the word COVID during the COVID time. So, yeah, what kind of things were you thinking?
Well, if there's a family emergency, someone has to leave. If there's other extenuating circumstances that would affect the business that's non-COVID related, that might not close the entire business down or be executive order related. I just think that not accepting any applications is clearly a prohibition from even considering something that might be an extenuating circumstance that might mean something relevant to someone's living. Again, I think there should be at least some flexibility for the administrator to look at the situation and determine whether or not it's within the board's purview to look at some exception or some interim appointment during the pendency and review of the newly mined bylaw.
Well, Bob, this only pertains to body piercing and microblading and all the others. It does not have any bearing on tattooing. So we have no one.
Yeah, I think it's.
There are no establishment
included,
licenses for body piercing, and we just have one establishment that's licensed for microblading, and that's a sole proprietor with
We don't,
Apprentice.
excuse me, Mr. Chairman, we don't have a microblading, we have a permanent makeup.
Oh, sorry, permanent
Yeah,
makeup.
permanent
Yep.
makeup.
So, yeah, so that,
Right,
I was
thank
going
you,
to say,
Susan.
Mr. Chairman, that would
Yeah.
cover what your ideas are. I think we're concerned about our currently licensed people, and they are only licensed for tattooing. So if we
Yeah, and it wouldn't impact
still
it,
accept
correct, yeah.
tattooing, that would be good.
And I think that discussion clarified the actual intent of the motion. And if you were just accepting tattoo applications, then I think that exemption is exactly what works. And that would be the amendment that I would put forth on the floor to accept only tattooing applications and no others.
Yeah, so Bob, I'd actually
I'm okay
put
with
together a
that.
motion thinking you weren't going to be participating tonight. So Maria has that. If you just want to read what I had sent you, Maria, and then you and Bob can see if the motion is fine as is or if it needs to be modified.
So I'll put forth the motion. Do you want me,
Well,
is
just
there
read it
still,
first.
I'll just read it to you.
Yeah.
So there'll be a 90-day calendar day moratorium on all establishment, practitioner, and apprentice permits for all modalities of body art except for tattooing, so as to allow time to complete the rewrite of the Tewksbury Board of Health body art regulation. This moratorium will go into effect on Friday, July 17th, 2020. What do you think?
I think that, if I may comment, I think that clarifies my position. I'm glad that the motion entertains the ability of everyone to continue to do business as usual with the administrator, and I would withdraw my amendment since it's covered in the main motion.
Okay. So now you can put forth that motion, Maria.
Okay, here we go. So I put forth the motion that there will be a 90 calendar day moratorium on all establishment, practitioner, and apprentice permits for all modalities of body art except for tattooing, so as to allow time to complete the rewrite of the Tewksbury Board of Health body art regulation. This moratorium goes into effect on Friday, July 17th, 2020.
Okay.
With
Someone
that,
willing to second?
I'd second that motion.
Okay.
I
So
agree.
motion's been
Yeah,
put
that's
forth
good.
and seconded. So all those in favor will signify by saying aye. We'll do a verbal roll call. So Vice Chair Scarano,
Aye.
Clerk Zeroulis, or Ms. Zeroulis,
Aye.
Dr. Bichetti,
Aye.
Mr. Rue,
I wish you read that initially.
and Chair votes aye as well. So the motion carries unanimously 5-0. Okay. Thank you all. Moving on to director reports.
Thank you, Mr. Chairman. I want to say that in the midst of COVID, we are actually doing our regular job, at least starting to. I want to let you know I did a soils test. We have a septic system that is actually going to be going in at Max Dairy Farm, which is, a surprise. And I'm doing some reviews of application. I approved the establishment plan for Aroma Joe's Coffee. And I'm still waiting in the midst of working on Theo's Restaurant, which is also on Andover Street. Both of them are in Andover Street. But we are fielding, generally, most of our day is fielding questions and responding to anything COVID, whether it be a personal question, whether it be an observation or a concern. That's pretty much Irby's day, my day, and Shannon, and actually Lisa too. We all field them equally and try to educate people, put them at ease with as much as we can with the rules that we understand them. And if we don't understand them, we do reach out to the Department of Labor and Industries and Labor and Standards, sorry. They are enforcement with us on this. I don't know if you saw Governor earlier this week who put us front and center now on the complaint website on mass.gov. You can actually just pick your town and click and make your complaint right there. So we work together. So I did reach out for a couple of concerns this week, and Department of Labor and Standards helps us interpret these myriad of different things. I have not issued any warnings this week. I have not, and we have not gone to any second level, which would be any, a written warning. So no verbal, no written warnings. We haven't done any fining. For those people who may not know, there's a very strict guidance or requirements that you have to follow when it comes to complaints, and that's what we follow. We do not. There's no ability to shut down places if there's a COVID violation. There's a strict criteria. We go from verbal to written to a fine, and then to court. So if there's a misnomer out there that the Board of Health is closing anyone down for COVID complaints or COVID non-compliance, that is not the case. So I just wanted to clear that up. And otherwise, we're just working on getting it done. And we're in phase 3, part 1. We don't know when phase 3, part 2 will come. That's about it, unless you have questions.
If I can just add to that, sort of on a personal note, I have received communication from a very passionate citizen that was very concerned that he was under the impression that the department had actually closed a restaurant due to COVID reasons. So I'm glad that you did clearly state that for the governor, we are not, or you're not to close any business, but it's verbal warning, written warning, then fine, and then court if need be. And the other concern this citizen had as well was about having to wear a mask in a restaurant when you're going in simply for takeout. And I know for restaurants, you don't need a mask when you're actually seated at the table. You need to wear a mask going into the restaurant to get to the table. But for takeout, you do have to wear a mask if you are going in the facility to pick it up. Drive-throughs, unlike other towns that require a mask of people in cars going to drive-through, we don't have that requirement. So I think, and correct me if I'm wrong, Director Sawyer, but I believe that Tewksbury has been very business-friendly in trying to help restaurants and local businesses reopen and navigate the requirements that the state has put forth on everyone. So I think that we've been doing an outstanding job of that. Unfortunately, in times of emergency, there's not always good, clear information out there being shared with everyone. So I wanted to take this opportunity just to make sure that everyone is clear what the rules and regulations are in terms of mask wearing, and that businesses are not to be shut down by the health department, and therefore none have been shut down.
Ray, if I might add to that, it is a business owner's purview to reject anybody coming into their business for almost any reason except recognized discriminatory. And if you don't have a mask on and their policy is that you must wear a mask, and they've adopted the policy of the governor and all of the protocols, he has a right to reject you and any other patron for almost any reason, and especially if it endangers his health or the health of his employees. So besides clientele, besides the fact that we have a mandate for masks, the owner still possesses the ultimate authority to reject anybody he feels is jeopardizing his business, his health, or his employees' health.
With the one caveat, Bob, of course, is that if there is a medical condition, that person can't simply say they have a medical condition and cannot wear one. And if that is the case, and they do not have to disclose their condition. And then what the business should do is, if it's something that can accommodate, if someone is coming to buy a certain item, okay, I'll bring it out to you. Or if they can't accommodate, then the person is allowed generally to enter without being, they shouldn't be a problem, because that's the law.
I would agree. I would agree, and those people that have that health condition are well advised to notify everyone around them, including other patrons and the owner, of their medical condition, so it doesn't rise to an altercation level or have to be mediated by someone else.
Yeah, I'm glad you mentioned that, because there are some citizens that are concerned that owners are letting people come in without masks. And yes, they can put up signage, and yes, they can ask, but I really don't think it's worth a verbal or angry confrontation. I think it's an opportunity, to educate and stuff, but I really don't want anyone hurt or berated, or so these people in food service and other industries, they do work hard, so there may be times they have to make a decision, and then maybe they cannot let them in next time or something like that. But it's not worth a fight, to be honest. This is not a sprint. This is a long thing we're going through. So it's if you can come up with a catchphrase, if you're a business person, thank you for protecting us, or please next time, or something like that. Just wanted to mention that, because it is tough for the kids, especially.
And the final thing I'll mention about masks is I saw that, I didn't see the governor's press conference today, but I saw a report from it that I guess he was asked a question about masks, and he stated that masks will be required of everyone in Massachusetts as long as there is still the public health emergency. Okay. Any other reports, Director?
No, Mr. Chairman.
Okay. Staff reports. Thank you for being on tonight, Irvi. And we actually get to talk to you about something that's not COVID related necessarily.
Yeah, everything we hear about right now is COVID, but we've got that flu season lurking around the corner. So just wanted to chat about that a little bit. I know that people are always in a rush, especially the senior population. They're always in a rush to kind of, as soon as the vaccine is available at their local CVS or their local Walgreens or other pharmacy, say it's like late August, they're in that door, they get their vaccine, and that's great. We want you to get vaccinated, but just to be cautious that getting vaccinated in August is not necessarily going to provide you the coverage that you need, the immunity that you need throughout the flu season. So really, I would say if you can at all help it, and you can wait until say September to get your vaccine, that I would advise that, or even mid to end of September. If you're provided, if you're at a doctor's office and an opportunity presents itself, your provider, offers you a flu shot, and they think that it's okay, absolutely go ahead and get vaccinated. But I'm talking more about like just getting to the pharmacy and trying to beat everybody else there. So basically the guidelines are that you want to be vaccinated before the season starts, but you don't want to be vaccinated so early that it's not going to protect you through the peak, which would potentially be in January or February. And for children ages 2 to 8, they're actually required to have 2 doses of the vaccine. And the CDC recommends that that children from the ages of 2 to 8 get their first flu vaccine as soon as it's available. And then the second dose of it can be given 4 weeks after that. So you got to plan for that. You know, you want to make sure that you're getting that second dose before the start of the flu season. And it takes about 2 weeks to actually build the immunity as well. So we got to factor that in to that lead time of immunity.
Okay, well, thank you for that.
You're welcome. Any other questions?
Now, I'm assuming that the town will be offering or running the flu clinics like we have in prior years.
Yep, so that is the plan as of right now. We haven't, thus far done, I don't believe, like a town-wide clinic, but we do offer the vaccine to the senior population. We're still trying to figure out what that's going to look like this year. So Susan and I and our colleagues are trying to figure out a plan to see the best method of making sure that that our residents are getting the vaccine.
Actually, it's a good point. I sort of forgot about that with social distancing and trying to know that the vulnerable population is also getting the flu shot.
Yeah, so a lot of other towns are looking into doing like drive-through or drive-up flu clinics. Like I said, we're just kind of barely not, I don't want to say we're out of COVID, but we're kind of, we're getting to the point where I can shift my attention a little bit to the flu season, and, we got to get planning. So that's probably the next thing on my agenda over the next, month or two.
Okay, well, good. And then any updates for us on COVID?
Yes, so I actually ran the numbers this morning. As of now, our current cases, 21 active cases. And actually, I need to communicate with the CTC supervisor to ensure that that number is accurate, because sometimes there's a little bit of a delay with the information getting over from the Salesforce database and into Maven. So it's probably closer to, I would say, 15. And then so far, we've had 13 deaths. And 222 recovered in the community. I'm not including congregate sites in that. We're not including the hospital. We're not including the state hospital in that. These numbers are for community members, for residents of Tewksbury.
Okay, well, it's a good low number.
Yes, I'll take it.
Mr. Chairman, I'd
Yes.
like to add that, since the June, before June, we did have a number of nurses assisting us, school nurses and who work for the town of Tewksbury and other locales. They've been doing it. And since school ended, Irvi has been handling this on her own. I just wanted to thank her for all her work and thank the nurses for all their work. So.
Thank you, Susan. I honestly can't say, thank you enough to the school nurses that helped me, because we were in rough shape for a little while. So a big thank you to the school nurses for really stepping up to the plate and helping where it was needed.
Now, sure, this was never covered on your initial job interview with the town either.
Who'd have thought?
It wasn't on theirs either with the school nurses. And we are also, and Ray, you'll be happy to know, we're also looking forward to reviewing our emergency plans. Irvi's just to the tip of opening that box. Looking forward to, just being prepared again. Everything is a different scenario, and so that is going to be that's on our table to bring to the town manager and work together.
Yeah, because the thing I'm looking at is that if they in fact do get the COVID vaccine, that's probably going to be like the H1N1, where we'll have the mass flu clinics where really everyone is in the best interest to get the vaccine. So
that's right. It's exactly what I'm thinking.
Me too.
So good time to dust off the plans.
Will that vaccine be available like the flu shot, or is this? I wonder. Like, will towns be able to offer this to people? Just something I was thinking, I don't know.
I can't answer that question.
Yeah.
I mean, H1N1, it was quite an event, and there was not enough for everyone to be at the beginning. There was a lot of prioritizing for first responders and the high risk. And in that case, if you remember, that was the first time actually children were really involved in the flu vaccinations, that H1N1 was serious for children and not just seniors. So it flip-flopped a little bit. So there was a lot of waiting for some people, and it was difficult because no one wanted to wait for the vaccine. So there's no way to know, how much they'll be, how they'll be distributed. My guess is, they would use the same format that we did before, and it will be local.
Sure.
I would hope.
Yeah. Okay. Thank you.
I had one question for Irvi, whether she had any further information on the immunity T-cell debate that seems to be going on in relation to the herd immunity issue and the T-cell advancements. And even if you weren't ready to discuss that this time, certainly I'd be interested in you looking into it for future discussion.
I actually have not, really bad feedback, sorry. I've not been able to look into it yet. I'm sure that it's in the forefront, and I'll be waiting for literature from CDC and other reliable sources. So I can definitely provide some information, hopefully at the next meeting.
That'd be wonderful. Thank you.
Okay, any other questions for Irvi?
No, thank you, Irvi, for all the hard work you did. Thank you.
Thank you.
Okay, any other business from any board members?
I think I'm okay on my end.
Okay. Susan, anything else?
No, Mr. Chairman.
Okay. Well, Mr. Rue, I think it's now become your turn.
Mr. Chairman, I'd like to make a motion that we close tonight's meeting, please.
Okay, so I'd like to second that motion.
Am I on? Oh, I'll second it.
Okay, so motion's been put forth and second to close tonight's meeting. All those in favor will signify by stating aye. We'll take a verbal roll call. So, Vice Chair Scarano?
Aye.
Ms. Arulis?
Aye.
Dr. Bichetti?
Aye.
Mr. Rue?
Aye.
Chair votes aye as well. So motion carries unanimously 5-0. So this meeting is officially adjourned. It is 6:54 p.m. So good night, Tewksbury.